The bill that President Trump just signed into law has states across the U.S. grappling with what it means for them. My next guest is a Democratic governor of a red state. Here with me now is Governor Andy Beshear of Kentucky. Thank you so much for being here. We do have a lot to get to, but I do want to start with the devastating news that we're seeing in Texas, because just a few years ago, you had more than 40 people die in your state. You had the worst floods in Kentucky history. What's your message to officials and residents dealing with this in Texas right now?
Well, to the people of Texas, Kentucky loves you. We know what you're going through. In July of 2022, we lost 45 Kentuckians, each one a child of God, to devastating flooding. What these families are going through right now is just pure hell. And what they need is the entire country to wrap their arms around them, to show them just pure love. And to everyone on the ground, we need your help in staying out of flooded areas so that first responders can get in. I know they're still searching for a lot of people. So we need to make sure that those in the boats and those in the helicopters have an unobstructed way to get to these places. And then think about what these families are going to need in the coming weeks, months, and years, and do everything you can to be there for them. We went through it in July of 2022. We went through it in February and in April of this year. So our heart really goes out to Texas.
Yeah, absolutely. Governor, I do want to turn to the giant bill President Trump signed into law, what it would mean for Kentucky. 1 in 4 Kentuckians are on Medicaid, 1 in 10 on food stamps. How many will lose their benefits because of this law? And what, as governor, can you do to help?
Well, this law is devastating. It's the single worst piece of legislation I've seen in my lifetime, and it is a congressional Republican and presidential attack on rural America. In my state alone, 200,000 people are going to lose their coverage. Those are 200,000 Kentuckians that deserve to see a doctor when they're sick. 20,000 healthcare workers are going to lose their jobs. And we've got up to 35 rural hospitals that are typically the second biggest employer in their communities that may close their doors. And what that means is our economy takes a huge hit. And then whether you have private insurance or Medicaid, if you live in rural America, you have to drive hours just to see the doctor that used to be in your community. It is awful. And that is before we even talk about the cuts to SNAP, which means that seniors and children will go hungry at night and wake up hungry in the morning. I cannot believe that Congress was willing to pass this. I mean, it's awful.
They did add about $50 billion for rural hospitals. You don't think that's going to help?
No, based on the massive cuts that are here, based on the fact that a rural hospital may have 40% or 50% of their revenue coming from Medicaid, this will not help to keep those doors open. And so what you're going to first see are rural hospitals cutting specialties. You may have to drive several hours just to give birth in many parts of this country. And just think about how the economic hit to these communities go. You lose 200 jobs from doctors and nurses and orderlies, and all of a sudden the coffee shop does worse. The bank doesn't have as many folks coming in. I mean, this is going to hit rural America right in the face.
Governor, this law adds work requirements for Medicaid on those who are able-bodied adults. Kentucky Republican Congressman Hal Rogers says adding these requirements, quote, protects the longevity of Medicaid benefits for our most vulnerable population and adds integrity and strength to Medicaid and SNAP assistance. One of the first acts of as governor, yours, was to end Medicaid work requirements in Kentucky. Why shouldn't people who can work?
Well, we want everybody that can work to work. And right now in Kentucky, we have the most people working, the most jobs filled, and the largest workforce in our history. And that is with our current Medicaid structure. That's because these work requirements really aren't about getting people back to work. They are about increasing the paperwork on everybody That's the senior, because 70% of our long-term care costs are covered by Medicaid. And that's children as well, with half of Kentucky's kids covered by Medicaid. These work requirements aren't just for specific people. Everybody else has to check all the boxes saying they're not able-bodied. And what happens is when somebody misses that one box, they are kicked off for 6 months or more.
Governor.
Meaning families have to take that parent or grandparent in. It means they have to cover all those other costs. All this is more red tape meant to kick people who should get Medicaid off of Medicaid.
Governor, I just asked that very question to the Treasury Secretary about the increase in red tape, and his response is Democrats think poor people are stupid.
It's amazing. Listen, I know a lot of people on Medicaid. These are our parents with special needs children that could have never covered it otherwise. These are busy people, all working 2 jobs already to support that child. And now, if they miss a deadline, if they miss checking a box, look at what happens. I mean, you can lie all you want about what's in this bill, but the numbers are the numbers. The predictions by the Congressional Budget Office are there. It's going to devastate rural health care, all while adding trillions of dollars to our national debt, and it's going to upend every state budget across the country. You know what's sad is that while Democratic governors are speaking out, we're not speaking out because we're Democrats. We're speaking out because we're supposed to be the best governors of our states that we can be. All these Republican governors that aren't saying a thing, where their rural hospitals are going to close, where they're going to see massive layoffs and people lose their coverage, that's pretty sad. You know, our jobs is to stand up for and represent our people, and I wish people would get back to that.
Governor, you've committed to serving out your term as governor, which is slated to end December 2027. Your name frequently comes up as a contender for the 2028 Democratic primary for president. You said you'll think about it after next year. What will make you decide that that's going to be a yes? You'll run for president.
So my primary obligation and what I'm putting all my energy towards is to be the best governor of Kentucky that I can be. Next year, I'll also be the head of the Democratic Governors Association. And I think especially in these rural states where Republican governors have not spoken up whatsoever to stop this devastating bill, we're going to have strong candidates. We're going to win a lot of elections, and hopefully that paragraph about who speculated in 28 gets bigger because we brought in more leaders. If you'd asked me this question a couple years ago, I would have said no. My family's been through a lot, but I do not want to leave a broken country to my kids or anyone else's. So what I think is most important for 2028 is a candidate that can heal this country, that can bring people back together. So when I sit down, I'm going to think about whether I'm that candidate or whether someone else is that candidate. I'm going to make sure we're putting the country first, because my kids deserve to grow up in a country where they don't have to turn on the news every morning, even when they're on vacation, and say, what the heck happened last night?
Governor, thanks for being here. Appreciate it.
Thanks for having me.